Portaldo Olmo has done a systematic review looking at surgical treatment in spastic hands. And the crux for this study is they're saying that spastic hand surgery was an option until the 80s when Botox came in, and now Botox has interfered with the amount of surgeries being done for spastic hands. So that's their hypothesis and they want to prove it, right? So what they get is they look through all the different databases and they find 501 abstracts and 22 articles that are finally selected, and all these imply that surgery is safe and useful, and it's an enduring treatment for post-stroke spastic upper extremities. But it was really only done in the worst of the worst cases with those who have hygiene impairments and not otherwise. So what are they getting at? One, they don't really have that many great articles. They have a lot of abstracts and nothing more, meaning that's how low they dipped to get this kind of a thing. But the methodology in these studies is kind of poor. Does that mean their opinion is worthless? Not really. The question comes back to, is spastic hand problems due to deficiency of surgery? The answer is no. So if it's not, then what's the value of a surgery? The value of a surgery is to salvage what exists. Now, Botox can do the same thing. So when should you Botox versus do surgery? Well, we know with Botox, you only inject it so many times and you get muscle fibrosis and atrophy, which is a real problem, on top of the expenses, right? So here, neurosurgical interventions for the spastic hand could be helpful, especially when you look at things like a median neurotomy to reduce flexor spasms. And we have, in our own experience, this thing actually works quite well. Of course, post-surgical rehabilitation is a big part of this, but think about it. When you can do one surgery and get these benefits versus repeated Botox injections every 3 to 6 months, which is better? The one that is less invasive repeatedly.